Major depressive disorder is considered the leading cause of disability worldwide, affecting 4.4% of the global population and causing an economic burden of $210.5 billion in the United States alone. Sex differences are prevalent in major depressive disorder. The rate of major depressive disorder is 2 to 3-fold higher among females, symptom severity is greater in females, and emerging evidence suggests that distinct molecular mechanisms underlie sex-specific major depressive disorder phenotypes. These findings support the rationale for gender-specific diagnostic approaches. However, the current therapeutic strategies do not consider these fundamental differences in male and female patients. We hypothesize that sex-specific molecular and transcriptomic profiles in major depressive disorder extend to treatment responses, advocating for personalized therapeutic regimens tailored to each sex's distinct biology. To identify drugs that may be targeted to treat male and female major depressive disorder patients, we first analyzed a publicly available major depressive disorder post-mortem human tissue transcriptomic dataset. GeoID for this dataset is GSE 102556. We use this dataset to identify female and male major depressive disorder disease signatures across 6 different brain regions implicated in the pathophysiology of major depressive disorder. Principal component analysis was performed for dimensionality reduction and identification of outliers. This raw data was aligned to the appropriate reference genome using a tool called HiSat2. Differential expression analysis of all count data was performed using EDGE-R. The Library of Integrated Network-Based Cellular Signatures, or LINCS, database was interrogated to identify chemical perturbagen, or drug, signatures that are discordant with female and male major depressive disorder disease signatures with a score cutoff of -0.5. The top and bottom 5% of the L1000 hub genes, based on a p-value of less than 0.05, were extracted and utilized to generate drug signatures. Unsurprisingly, several established antidepressant medications, including the selective serotonin reuptake inhibitor fluoxetine and the selective norepinephrine reuptake inhibitor venlafaxine, were discordant across brain regions in male and female groups, suggesting the robustness of this method in identifying known therapies that reverse the associated pathology. Interestingly, antipsychotics, such as olanzapine, were significantly discordant with male major depressive disorder signatures across specific brain regions, lending support for off-label use of antipsychotics for the treatment of major depressive disorder in males. Overall, distinct transcriptomic and drug signatures were found for females and males based on brain region. Further analysis is needed to decipher and cluster the mechanism of actions of drugs within each profile, which will give broader insight into sex-specific treatments for this devastating and challenging illness.